Today we will be talking about cirrhosis of the liver. This video is for educational purposes only. If your doctor says something different to this, please listen to her or him. By Dr. Squared MD. Cirrhosis occurs after fibrosis, which can lead to hepatocellular carcinoma. Let's first talk about how NAFLD can lead to hepatocellular carcinoma. NAFLD, which is non-alcoholic fatty liver disease, can worsen, then can go to fibrosis, which is scarring of the liver, which then can lead to cirrhosis, which is even more scarring of the liver tissue, and more bumps on the liver, which then can lead to hepatocellular carcinoma, which is basically liver cancer. Overview of cirrhosis. Cirrhosis occurs after fibrosis of the liver. Cirrhosis is the 14th most common cause of death in the world. Cirrhosis is the 4th most common cause of death in Europe. Cirrhosis is the 12th most common cause of death in the US. And more than 1% of people die because of cirrhosis. Etiology or causes of cirrhosis. There are many causes of cirrhosis. Some of them include hepatitis C, 26%, alcoholic liver disease, 21%, NAFLD, non-alcoholic fatty liver disease, and NASH, non-alcoholic steatohepatitis, 18%, hepatitis B, 15%, autoimmune hepatitis, 1%, primary sclerosing cholangitis, 1%. There's many more, but all of them are less than 1%, so I didn't add them. Also, about 2.5% of Americans develop non-alcoholic steatohepatitis. About 10% of these patients will develop cirrhosis. Clinical manifestations of cirrhosis. Portal hypertension results from increase of portal venous inflow and increased resistance to blood flow. Esophageal varices. It can be a result of portal hypertension. The veins in the esophagus get swollen, then can rupture, which will lead to bleeding. Ascites. The second most common complication of portal hypertension. Ascites is the abnormal fluid in the peritoneal cavity. Spontaneous bacterial peritonitis. It has a very high mortality rate. It is an acute bacterial infection of ascites. Hepatorenal syndrome, renal failure with patients that have been diagnosed with cirrhosis. It is normally the result of splanchnic vasodilation. Hepatopulmonary syndrome, hypoxemia because of intrapulmonary vasodilation. This occurs in about 25% of patients with advanced cirrhosis. Hepatic encephalopathy. Hepatic encephalopathy is a disorder that can change personality, emotions, and normally something called asterixis can occur, which is like flapping of the hand. According to one study, about 50.7% of children with chronic liver disease develop hepatic encephalopathy. If you have any questions, please comment down below. And also, the treatment of cirrhosis, normally there is not really a treatment, so you normally just need a liver transplant, but there's not that many liver that are willing to transplant so far, so really you just either have to wait for one, or there's a few medications, but really the main one you would want would be a liver transplantation. If you have any questions, please comment down below.